Incoming Gilbert High School freshman Connor Bowers is checking in to get his sports physical for the upcoming athletic season.
Most of the time they would just take you in, check your ears, and then they do the hernia check, and then you're out. But this one was a lot more extensive, checks all your muscles, and it's definitely more prone to finding like an injury.
To me, quite truthfully, this seems to be a more thorough process than what I've done in the past.
Gilbert High School was one of the locations parents could bring their student athletes to get their checkup.
So at a university and a college level, they have official team docs that take care of the team. They have athletic trainers that are on site at the schools. And then they have a network of subspecialists that work specifically with that school. And our program mimics that for the high school level athlete.
Sports physicals are just one of the many services OrthoArizona and Dignity Health Mercy Gilbert Medical Center offer in their joint sports medicine program at the 5 high schools in Gilbert.
With each of those athletes, as they come into the schools and they pay the amount for the physical exam, which this year is $25, they get a comprehensive examination that includes specialists and sometimes even subspecialists to evaluate. But all of that money that gets collected goes straight back into the school's athletic training program.
OrthoArizona sports medicine specialist Brett DeGoyer says their sports physicals are very comprehensive. Some of the tests include checking blood pressure and vision, along with orthopedic screens.
If they screen positive for anything, then we have our orthopedic surgeons right here on site to make sure that they either need a follow-up visit or no, this is within normal expectations and they're fine.
Other screenings include neurological and cardiac issues.
So that anyone who comes through our program and screens positive for any cardiac issues, we send them a referral straight to the cardiologist. Now most of the time, granted, athletes 9 out of 10 will come through and they'll be fine, and there's nothing that really needs to be done, and that's fantastic. But they really need a more comprehensive screen, and that's what we have aimed to provide at these events.
They seemed like they knew what they were doing, and like they could easily tell like really fast what was going on, if you're good or not. So I mean.
Connor's mom, Leslie, believes these types of screenings are needed to keep young athletes safe.
It helps the child, too, check in with their bodies to realize, if there is something wrong, that they need to play a part and take care of themselves.